Oh, great. Good morning. Hello, everyone. My name's Ann Derouin. I'm so delighted to be with you here this conference. I really wish I was in person with everyone as well, but I'm really delighted to be able to share information with you this morning and hope it's helpful. Let's just move my slide. I do not have any conflicts to report, and all the photos that are in this presentation are used with permission. My learning objective is just to illuminate some strategies to promote social justice that we can use as nursing professionals. I am primarily an academic, but I also work in clinical settings, and I'll try to share with you aspects of both where we might be able to be promoting social justice in any aspect of our work. It's built into what we do as nurses. It's written in our code of ethics to promote social justice. It's certainly what all of us do in our work. But if you feel like you're getting pushback or you're not sure how to actually start this conversation in your workplace or with your community, you can start here. The Academy of Medicine provided this document with us, an update from the first document 10 years ago. The Future of Nursing report was published last year. And in it, it actually asks and suggests and promotes nurses to act as the catalyst in achieving health equity, promoting social justice, relying on us as the largest and most trusted healthcare profession to really be the catalyst for the change and for future. And we have already started doing this, obviously, in years and years that all of us have practiced and our profession has been active. But this is a true call from our colleagues in medicine and science to truly pick up the torch and move forward to promote social justice. Within the report, if you haven't seen it, you can download it. There's some wonderful videos that provide some input on where we can start. But you can see that the model suggests that nurses working in any healthcare workforce, in leadership, certainly in education or academics, have opportunities to promote social justice. There's also a call for strengthening our well-being and resilience. That makes perfect sense given the season that we have come through, and to also be the biggest catalyst for preparing for emergencies, both nationally and globally. And all of these roles in which we intersect then have implications for understanding the effectors of health, reducing structural racism, and promoting social justice. So what I want to share is some of the work that we've done in the Duke Health System and at the School of Nursing, and help ask that you consider where you might replicate this, or maybe you've already done it and you want to think about where else might you be able to use it in your practices. The first thing that we've done is we've looked at our mission statement, and our mission statement is something that you think of as a call to action. It's your banner that you wave, and whether you are in a clinical practice, an academic setting, a healthcare enterprise, really there should be a mission statement. Why are you here? What are you called to do? And so we took a careful look at this in our community, and this is our new mission statement. You're the first professional organization to actually see the unfolding of this. Our new call to action is that we advance health equity and promote social justice by preparing nurse leaders and innovators with a commitment to improving health outcomes through transformational excellence in education, clinical practice, and nursing science. This is what we are going to base evolving curriculum off of, all of our work at our school. And this is reverberated throughout our whole enterprise, which other schools and healthcare agencies that we're connected with are looking at their mission statements thinking about, well, what is our call to action, and should we be updating our mission statement in this current environment? What I would suggest is wherever you work, you could do the same. If you don't see a clear call for advancing health equity or promoting social justice in your mission statement, please advocate and think about, is it time for an update? And that's true in every setting in which nurses work, and really can help set your barometer, if you will, or your compass for your next steps as you go forward in your practice. Some other things that we have done, this is all related to academics, but certainly could be translated into clinical practice or a healthcare enterprise, or certainly if you own your own business. But ensuring that everyone in the agency and the organization has completed some bias training. Have they looked at their own personal biases? Do they recognize their blind spots? Do they see where there's areas for improvement or growth in understanding the perspectives that other people come with? We took a very serious look at this in our organization and did ask everyone to do bias training and ongoing workshops to ensure that we were really thinking of the perspective that we are coming from, and we're thinking of the perspectives that others come to us with. We have begun to blind all of our interviews for incoming students. All the prospects and students who apply at our school are reviewed with one faculty member, and they are interviewed with an intentional blinding when we actually still do interviews. Some schools have forgone interviews, but we still do personal interviews with each candidate that comes to our school. And we have decided to come to that interview using a standardized set of questions, but blinded to the candidate's information, their resume, what school they went to, where they practice, so that we don't come with a bias on what we think we're going to hear the prospective students say, or what examples that they might bring. And it's been very, very helpful to just hear each candidate's story verbatim right from them without having that information beforehand to bias. We have started to look at holistic admissions. We've done a lot of training on that. We are looking for the admissible pool of candidates, not the top pool of candidates, not the best GPA, but rather considering what attributes do we want all of our community members to come with. And so we've asked many of the faculty and done various workshops to say, what experiences, what attributes would you like our students to come with? Is there any leadership qualities that we're looking for? And from that pool, we then find these are all the students that are admissible, and we try to look at the approach towards building our community in that way, rather than picking and choosing candidates out of a pool. We look at the admissible pool and bring them forward. We have also realized that sometimes candidates who are coming to either nursing school or graduate nursing school aren't really sure what to expect, how to prepare the application, or even what's the experience going to be. So we have started working with prospective candidates on how to prepare your written statement, CV or resume workshops, suggestions on things that often get left off of resumes, particularly in leadership, volunteer work, areas of expertise that don't always get shown on CVs or resumes. And we've built mentorships with both high schools and universities that do not have graduate programs, so that students can already start to think about, yes, I'm going to be an amazing nurse at the bedside or in the community across the spectrum, but I could also envision that I could do advanced practice and enter into a graduate program, either a master's or a doctor of nursing practice program. That really does take mentorship. It's something that the DNPs of color are really excelling at. And we feel that this is very, very important in both clinical practice and academia. We've also started using alumni, alumni panel members, an advisory board, key stakeholders in our community that are partners with us to think about reviewing the candidates, not just faculty who could have bias, but also key stakeholders. I feel like this is the same approach that we need to be thinking about as we hire our nurses and our advanced practice nurses, a holistic approach to bringing forward the profession, thinking about the attributes and those desirable qualities that are going to make a difference in the delivery of care for patients, reducing inequities and promoting excellent health outcomes. Our school also realized as we were doing this work, thinking about our biases, thinking about where we were at, that we needed to review the content that we were actually delivering to our students. We actually looked at all of our slide decks, all of our syllabi, and all of our recordings, and found that there were things missing. There were definitely images that looked a lot the same, very homogenous. Started updating all of our slide decks to show people across the globe, people of color, people of all ages, people that had various disabilities, and really trying to be much more inclusive in what we were depicting in our academic content across the spectrum. This was a big awakening for us, and it's something that I have carried forward and encourage anyone listening to think about, whether you're in clinical practice or in academia, to do the same. I realized in my clinical setting that a lot of the materials were not always in the correct language. They didn't, some of my anticipatory guidance materials looked very similar. I wasn't always depicting everyone that I was caring for in a thoughtful manner. So regardless of where you're practicing, this is another important step to think about, is reviewing your content, reviewing what you're sharing, and think about what your audience is actually seeing, and be willing to look at it through a new lens so that you can update it and be thoughtful. I won't read this statement, but we also realized that we needed to walk our talk. So we not only have updated that mission statement, but almost 2 years ago, we added this statement of diversity, inclusion, and belonging to every single one of our syllabi at Duke, so that our students, all of our faculty and our staff understood what we believed in. We recognize that there could be microaggressions or macroaggressions that happen in the classroom or in clinical space. And if, in fact, someone experienced that, they could utilize our website to report that. They also were encouraged to reach out to the faculty of the courses. Again, this easily translates into clinical settings or healthcare enterprises where you can make public statements to make sure that everyone in the community understands what the expectations are and looks forward to a future in which we all belong. Other examples that are very tangible, certainly the DNPs in color, everyone that I have met through this organization is very well aware of this. But these small but powerful signs, the small lapel pins, our Zoom backgrounds that reflect what's going on, whether it's the month-to-month background that changes or something that you're celebrating in your community, taking a moment to actually change your background to reflect what's going on in the season, what people might be thinking about or celebrating, is really important. And these are some of the examples that we have used in across our health enterprise to celebrate different seasons throughout the year and use them as our background when we're having presentations or meetings or conferences, just to illustrate that we're in this together. We have also integrated service learning. So things that have emerged in the season have been recognition of the land in which our university sits on. So doing things like a verbal land acknowledgement happening at commencement, special occasions. These can be really, really important to recognize and depict the inclusivity, acknowledging our past, recognizing as we go forward. We've also really tried to do community engaged learning so that when we think about sending students or learners or clinicians out for learning opportunities or volunteer opportunities, it's something that the community asks for. It's not something we assume that is needed. And this does take extra steps. It means asking the community, being engaged with the community in an ongoing way, being a good partner, certainly not making assumptions or using a bias on what a community or a volunteer organization might need, but actually asking them. What's evolved from that is that we have ongoing partnerships where we deliver flu vaccine to communities that are not able to get to a clinical setting. We can raise money through walks or events that the community service organizations actually invite us to be part of. We've done things like coat drives, food drives, sock drives, those kinds of things that the community volunteer organizations ask us to be a partner with rather than us assuming. And we also do this even in community assessments in which our students will participate when there's the biannual community assessment. Will actually join the organization to make an assessment of that community. All of this is driven by the community's needs, not by us as moving forward to say, we think you might need this, but actually engaging it. And all the research is actually community driven, things that they, volunteer organizations or other service organizations are saying, I need help understanding this aspect or that aspect, and using the nurses as allies in answering those questions. So what are the outcomes of all of this? Well, our graduates have become much more diverse. Our goal is that our students that are emerging into the workforce reflect it and look like the community in which they serve. So we definitely are seeing that. We're seeing much more service outcome. This is our dean out in the community working, delivering COVID vaccines and working with community members that ask for that. We're seeing much more scholarship that is promoting social justice as well. And these are examples of that. I'll finish by saying, I hope this is helpful, that it's just giving you a depiction of some of the examples that we can easily do, that some of the smallest examples to the largest examples. And they certainly are happening in academic settings, but they can extend to any other clinical setting or enterprise. I'm going to open the chat and I'll stop there.
We're actually going to have the participants email you any questions if they can. Okay, thank you so much.
You're welcome. Thank you.